I think it's a remarkable advancement of the mandate of Africa CDCs. It makes it an autonomous health agency responsible for health issues on the continent. So that is the equivalent of what WHO is to the United Nations, which is a good thing for the continent because over the last 2 years, the political leadership of the continent, including the head of states, have actually seen the value in having their own public health agency. They have actually turned to the agency about 18 times to get advice on the pandemic. So it is a natural evolution from a specialized institution to a very broad-based public health agency. It allows for operational, managerial, and functional autonomy of the organization.
Let's talk about the coronavirus pandemic. Africa has recorded over 11 million cases of COVID-19, more than 2 years in the pandemic. How do you assess the situation currently?
The situation of the COVID-19 pandemic in Africa, as you stated, is where we are seeing a steady decline in the number of new cases over the last couple of weeks, which is good news. Most countries have now gone through the fourth wave, and some actually have gone through the fifth wave. But overall, we see that we peaked during the Omicron, and as a continent, it has declined significantly with almost 25% reduction over the last couple of weeks. But it doesn't mean COVID has gone away. We have seen this scenario like 4 times, where we see a peak and then we see a decrease and then we see another peak. My advice to the continent is that use this period of low transmission to reinforce uptake of vaccinations, to reinforce that we have public health measures, not necessarily lockdowns, but make sure that you open up the society in a more careful manner in order not to bring back a sharp rise in the number of cases.
Speaking of vaccine inequity has been a problem faced by the African region. Recently, in an interview, you spoke about asking that all COVID-19 vaccine donations for Africa be paused until the 3rd or 4th quarter of this year. Can you elaborate on that? Is vaccine supply no longer a challenge for the continent?
We are beginning to see a very steady supply of vaccines. So the supply side of the equation is good. But the demand side of the equation is where we should be focusing a lot on. And what I referred to in that interview in Politico was that we should more coordinate our donation efforts and then make sure that we sequence it over the 3 semesters and not to donate everything during the first quarter, and which will end up overwhelming countries to vaccinate as well as leading to expiration of doses. The focus now should be to support countries so that they can actually scale up uptake of vaccines. As we speak, only about 15% of the continent of Africa has received full doses of vaccines. That is 2 shots of the vaccines in case of those who are receiving double doses there. So if the target is to get to 70%, and the continent is at 15%, and then that tells you that you have a long way to go to get to that end point by the end of this year. We need more partnership. We need to be more strategic in the way we donate the vaccines on the continent.
We've seen that vaccine hesitancy has been a serious problem for the continent, and not just Africa, many places in the world. How do we engage the population, the communities?
We have to be innovative. And in several ways, we have mobile vaccination units that will bring them to schools, universities, marketplaces to convince people to vaccinate. It means we have to engage the community more deliberately and find champions like religious leaders. In our own experience, working with the MasterCard Foundation initiative that we launched several months ago, we've seen that if you engage religious leaders and other community leaders and civil society, your uptake of vaccines increase. I think we have to look at that. We have to look at the youthful population in the continent. Remember that 65% of the population of the continent of Africa is less than 25 years old. So it means that segment of the population needs to be engaged in a very, very deliberate way so that we can increase uptake of vaccine. We cannot give up.
Dr. John Nkengasong, thank you so much for your time. We appreciate it.
Thank you. Thank you for having me on your program.